Welcome to the Make a Mental Note podcast, where mental health professionals share information and perspectives that illuminate, educate, and is worthy of a mental note. And now your host, Chris Quarto.
Hi, everyone. This is Chris Quarto. Welcome again to the Make a Mental Note podcast. Thanks for joining me. Well, the mental health tip for today has to do with grounding. Grounding is a technique that people can use when they're feeling distressed, when they're feeling overwhelmed. Some people describe this as having an emotional meltdown in some cases. Well, here's how it works. Wherever you're at the time, just look around you and find 5 things that you can see and look at each of those things individually just for a brief period of time. Maybe just for several seconds. And then find 4 things that you can touch and touch it and notice the texture, notice the weight, notice what it actually looks like, whatever it is that you're touching. And then 3 things that you can hear and listen to those individually, briefly. 2 things that you can smell, and then 1 thing that you can taste. Now, here's what happens. If you notice that we're focusing on the 5 senses, and this grounding technique is actually a way of distracting you from your emotions, from those intense emotions. And that's the idea. So even if this technique doesn't turn off the faucet all the way, so to speak, that emotional faucet, if it can turn it down just a couple of notches so you're not feeling as intense, then the technique has worked. So my challenge for you for this week or within the future, whenever you're feeling emotionally distressed or overwhelmed, is to give this a try and see how it works for you. And that's my mental health tip for the day. Okay, my interview today is with Lisa Bahar, a therapist out in California. And without further ado, here is Lisa. Hello again, mental note takers, to the Make a Mental Note podcast. Thanks again for joining me. Well, today's guest is Lisa Bahar, and she is a licensed marriage and family therapist and a licensed professional clinical counselor in Newport Beach, California. And we haven't had anybody out of the state of Tennessee yet to join us on the podcast, so I'm kind of excited to have somebody from far away to join us to tell us a little bit on about their take on the mental health profession. So welcome to the podcast, Lisa.
Well, thank you so much, Christopher. I'm happy to be here.
Well, why don't you go ahead and tell us a little bit about who you are and what you do for a living.
Well, I'm a Newport Beach, California licensed professional clinical counselor, as well as a licensed marriage and family therapist. And I work with individuals, groups, and couples and families. And I provide what we call dialectical behavior therapy, which is a skills training.
And how long you've been doing this, Lisa?
Close to 10 years.
Okay. What I like to do when I have guests on the podcast is talk to them a little bit about why they went into the profession, and perhaps you could share a little bit with the mental note takers what motivated you to go in this direction.
Well, it's my second career to be a psychotherapist. My first career was working with film and television production, so I had a degree in cinema television production, and I worked in Los Angeles for a period of time. Working with character development, working a lot with writers, and just found that I wanted something new in my life. And so I had a little change of life and decided to go into psychotherapy as probably more of a personal exploration, but it just turned into actually a professional goal that I wanted to venture into a career for therapy and psychotherapy to help other people.
Was that a hard transition to make? We've had other guests on the show who have done similar things to you. They started off in one career and then for whatever reason it just wasn't fulfilling for them, or they just wanted to change and they made that transition. Was that difficult for you to do, Lisa?
It really wasn't. I mean, some people make an assumption about going from cinema and movies and television and then falling into psychotherapy and what a reach that is. But actually, there's quite a few similarities. I was studying people as a development executive as well as a writer, and then also working with clients now. I'm consistently studying human behavior. So it wasn't a difficult or challenging transition. I thought it was very smooth and seamless, but it just fell into place for me, and I was more guided than anything to fall into a career this way. It wasn't planned at all. It just happened to turn out this way.
Yeah, so you were able to use some of those skills that you had used in your previous profession and I guess apply them in what you're doing now. And, with the training that you had gotten, I bet that really, I guess that background probably really helped, didn't it?
Well, it did. And ironically, you never really leave your past. My past followed me, and I actually do a group called cinema therapy. So I do employ my past experiences as a, cinema television production major at USC. I was always involved with the movies, but I use the movies a lot within my therapy practice with clients, and it's very effective, and clients really love it. So it really did prepare me for a unique take on life and how to relate to people through movies and television, and also therapeutically.
You had mentioned a couple of different things. I heard you mention cinema therapy and dialectical behavior therapy, and I want to talk a little bit about those because those are, for the audience, they may not be familiar with either one of those. So if you wouldn't mind, just say a little bit about each one of those.
Well, I'll start with cinema therapy, and then I'll go to dialectical behavior therapy. They're
All right.
both very powerful interventions. Cinema therapy uses film and film stories for the use of relating to clients, and sometimes movies or television, for example, is a way to bring forth a process within clients that maybe they might not be as comfortable doing just on their own basic talk therapy. So movies are very creative, they're very gentle, they can bring in a very therapeutic process in a very creative and unique way. And the clients choose the films that they want to view within a group setting or even individual. So cinema is used as a way to relate to clients and clients to convey how they feel with a film.
Okay.
So that's cinema therapy. And then dialectical therapy is, well, it was originally started for a particular population that was diagnosed with borderline personality disorder. That was the test population on this intervention. It's an evidence-based therapy.
All right.
Developed by Marsha Linehan. And it's 4 sets of skills that give clients the capability to cope with life. I mean, I call them life skills, if anything. It's transdiagnostic, so you don't have to be borderline personality diagnosed. But they're very valuable skills for people to cope.
The cinema therapy, let's go back to that just for a second. And I'm wondering, you've had clients watch different types of movies to, I guess, help them address issues of some sort. Tell us a little bit about, maybe a couple of movies that they've watched and how it helps them.
Well, the movies can illustrate, for example, a metaphorical experience would be one of the standards I like to take note, which a lot of people understand, is the Shawshank Redemption.
Okay.
Is a very classic movie that a lot of clients might relate to in terms of, for example, their own depression. Being locked up in a situation or feeling locked down by their own feelings of being repressed or depressed, and how to break free from that, and how to create a life and build a life worth living. They can use the Shawshank Redemption as a way to bring forth feelings of being shut down, closed off, but feeling as though they have a way out. And it's very effective to convey that creatively, and the Shawshank Redemption is a classic one that a lot of clients respond to. There's quite a few other ones that I could highlight. For example, White Oleander is a great film that clients sometimes want to explore with regards to a mother and daughter relationship and feeling the the bond between a mother and daughter, loving your mother, for example, but then feeling very controlled by a mother can be also another example for clients to use in the therapeutic process. That was more of a recent one that some clients used to express and explore the relationship with their mothers, for example.
Okay. So it's almost like movies can be, well, I guess they can be a springboard for issues for discussion in therapy. And also, I guess that one of the things that you're trying to do perhaps is getting the client to maybe identify with the characters in the movie, and maybe that provides something for them to relate to be able to discuss in therapy as well. Is that kind of how that works?
Absolutely. It's exactly how it works.
Okay. So what kind of transformations have you seen in clients who have used this approach? I'm sure you've seen some pretty powerful things in your work.
I have, and it doesn't always happen right in the moment. It might. There's that magical moment of insight that could potentially happen within a session or a group process.
Okay.
And that's very exciting. And the shifts or the changes that start to occur, they happen over time, but when you look back, you can see how it actually happened. So many times you can see it happening, but then there's other times when later on, the client starts to have a different take on life or a different perception on things and isn't as rigid in thought process or extreme in the ways that they see things. So it's a very unique and it's a very gentle and creative intervention that takes sometimes a little time, but on the other hand, you can sometimes see it right when it's happening. You see it in the aha moments, the looks in the eyes, the, oh my God, that you're right. It's very magical. It's hard to put into words because movies are so creative and unique in the way that they speak to us.
Well, and I like the word that you just used there, creative, because I think that with certain clients, it's not easy for them to talk about their feelings. And
exactly.
So I think we as therapists, we try to come up with creative ways of helping, smooth the process, making that easier for them to talk. And I think and that's what I like about this approach, is that perhaps this is a way for clients to, look at themselves, to kind of think things through. But like you said, maybe it doesn't happen necessarily in the moment, but that it's something that they can kind of like let stew and just kind of simmer. And then over the course of time, they talk about these issues with you in therapy. And I really love that creative approach. I think that that's a great way to work with clients. Now, with the dialectical behavior therapy, this sounds like something maybe a little different from the cinema therapy. Now, do you use both of these approaches with groups of people or just with individuals, or how does that work?
Well, I do, just to give a little insight to the way I run a DBT group, for example. Well, let me answer your question.
Yeah.
I work with the groups in cinema therapy, but also an individual can come in and say, have you seen this movie? Or I have to show you the clip from this particular film. This will tell you exactly what I'm going through.
Sure.
So the client might introduce in an individual session a scene from a movie. I can't take the whole session and view the movie with the client, but many times they'll bring a scene in, for example, to illustrate an experience or just something that they want to feel to help me understand, for example.
Sure.
So that's one way. But I do the groups for cinema therapy primarily.
All right.
And then also with the DBT skills training, I'll do the groups as well as individual skills training. So they'll be in my groups, and then they'll also be either seeing me for skills training as well for individual.
Okay. Well, let's talk a little.
And I use cinema. Oh, excuse me.
No, go ahead.
I use cinema clips to illustrate skills. So I'll use clips from movies all the time to illustrate a skill that we're studying or working on. Yeah,
and that's a good idea because that way it doesn't take quite as much time, I'd imagine. I kind of do the same thing in teaching. And, it's just a really good way to illustrate certain things to students in terms of teaching. And I'm sure the same thing applies to clients as well. Well, let's talk a little bit about the dialectical behavior therapy groups. And, you've been running these groups. And I wonder if you find in running those groups, Lisa, if there are common themes or stories that tend to underlie clients' problems. What types of themes emerge when you're working with those types of clients?
That's a really good question. The themes tend to evolve, and you're right. Some groups seem to find one particular theme for that particular group that they're all relating to. They just so happen. That happens more often than not. Mm-hmm. And I guess I just realized that after you asked the question.
Yeah.
But the skills are designed for any theme. Mm-hmm. And it's hard to find a skill that's not present in DBT. That's the beauty in my mind of why DBT is so effective. Is there's so many different skills that it's hard to find. It's hard to say, oh, there is no skill for that particular problem.
Okay.
But I'll find a lot of anxiety or ruminating thoughts or negative self-talk is a dominant theme. Okay. More often than not. Mm-hmm. As well as self-injurious behaviors, and that could include any kind of addictive kinds of behaviors, or impulsivity is definitely a dominant theme. Mm-hmm. Being able to ask for what you want or say no effectively is a dominant theme. And also just feeling as though your emotions are taking control of you, or an individual will feel as though their emotions rule them. Mm-hmm. Or they have no control over their emotions, and they want to build mastery over their emotions, or at least understand them and not avoid them, and become more aware of them is also a very dominant theme. And just FYI, I use that movie Inside Out in DBT all the time to illustrate emotions.
That's a great movie. I love that one. Well, and you mentioned the word addictive, that's one of the themes in the groups. And, mm-hmm. I think when you work with borderline clients that some will have the self-harm type of behavior that's going in, do you find that some of those self-harmful behaviors, cutting on themselves or whatever it is that they do, can that be addictive? Can a borderline client actually become addicted to doing that, to cutting on themselves, if you know what I'm talking about? And if so, why is it that they do that?
Well, it's a coping skill. So the way I explore it with the client is to find out how the coping skill of cutting, for example, works. Okay. Because it does, because they're doing it. So there's a reason for that. So in a non-judgmental, more of an evaluation way of what are the pros of cutting, what are the cons of cutting, mm-hmm. what would be the pros of implementing a skill, but first finding out what does the cutting offer the client. And it might mean that for the client, they might feel a sense of relief. Mm. They might feel finally that they can feel, mm-hmm. whereas before they're numb and they don't feel anything, or they're shut down. That the cutting creates a physical sensation, which creates an emotional reaction, which creates a feeling, and they feel alive. Okay. So what I'll do is explore that with the client on how it works mm-hmm. for them, and then identify skills in DBT of what could be the alternative to cutting, for example. And then the next step would be to practice, and then charting a diary card or a practice method that they would review with me each week on how the skills were used, or if they weren't used, what stood in the way of using them, okay. and what their goals are. But they have to initially want to stop cutting. If they come in saying, I really want my cutting, then we got to look at that. I'm not going to judge it. But if they don't want the help in terms of a skill, well, at least teach the skill. I'll teach the skill, and then I'll await for them to make the commitment to start practicing the skill.
And I suppose that's similar to a person who is an alcoholic or a drug addict who has to get to the point of, okay, I'm ready. It's time. Right. I need to do something, whether it's hit rock bottom or maybe they didn't hit rock bottom, but they've made the decision, I've got to do something about this, that it's really their choice, their decision. And at that point, they're ready for change. And I think sounds like that's a similar process here. And I want to talk to you a little bit more about those skills that you use in in DBT. But before we get to that, I just want to go back to the feelings you were talking about, because I think I heard you say that a lot of times they feel anxious, and I wonder, with these clients, where do these feelings come from to begin with? I mean, they have these feelings, and they're using cutting, I think I heard you say, sort of as a coping tool or a coping mechanism. But where do the feelings come from? Why do they have these feelings? I guess that's what I'm asking.
Well, I mean, there's probably a variety of possibilities of where they originated from or what was happening. But generally, you might find that a lot of clients might have had some traumatic experiences, whether it's childhood trauma or even early adulthood trauma, that the cutting serves as a way to cope with traumatic feelings or disassociating, meaning, I don't know if most of your listeners will understand the ideas of disassociating or feeling numbed out or not connected with the body. The clients will cope in those ways, and the cutting serves sometimes to reconnect with the body or cope or self-soothe.
Okay.
But where they come from is, every individual has their own story, but perhaps a more dominant theme would be trauma or abandonment or difficulties with adjustment or a lot of upheaval in one's life, a lot of difficulties to adjust to situations, inconsistent caregivers, etc.
Yeah, and we've heard a lot of other guests in the past have mentioned those same things, not only in relation to cutting, but with addiction or depression or anxiety disorders, whatever the case may be. It seems like those a lot of times, not always, but a lot of times those themes kind of relate back to early childhood experiences, what their relationships were like, the attachment and those types of factors. So, I don't really see myself as a big Freudian or anything like that, but I do think that there is something to be said about those early attachments, and as laying perhaps a foundation for what happens later on in life, and perhaps that if a person has the insecure attachment, that's laying basically a shaky foundation for what happens later on in those relationships. So, well, tell us a little bit about those skills now. So we know that these women, they're coming in with these issues, maybe these traumatic histories, or maybe something that just happened to them more recently, but perhaps they had the trauma, but they have these feelings. They're not dealing with them very well. They might be cutting. They might be acting out in other ways. So what are some of these skills that you teach them as part of this DBT process?
Okay. Well, the first part is for men and women. I have a lot of men who actually respond very well to these skills. Okay. So it's both the men and the women who respond to them. And there are 4 what we call modules in DBT. And the first set of modules is called core mindfulness.
Okay.
So core mindfulness is based on the Zen philosophies. It's an Eastern thought, an Eastern method of skill set. And it's evidence-based therapy, and it includes skills, for example, as the observe skill, the describe skill, the participate skill, non-judgmentally skill, being effective skill, and one mindfully skill, as well as the being and doing and the wise mind, or the reasonable, the emotional mind, and the wise mind. And the goal for core mindfulness is to set the foundation for the wise mind, for the client to be able to identify when they're in the emotional state of mind, which is actually what we call dysregulated at times, highly reactive, disproportionate to what might be happening. That's the emotion state of mind. So the goal is to calm that state of mind. So employing one of the mindfulness skills is one of the first steps in DBT, is to identify when you're in the emotion mind, engage a reasonable tool, which is the reasonable state of mind, in order to respond to a situation from the wise mind versus react from the emotion mind.
So
So that's the first set.
So part of this process is really helping them to become more, I guess, self-aware, right? To become more aware of what's happening inside. And I'm not sure why it's happening, but at least to get them to be aware of what's happening. So what's next?
That's exactly it.
Okay. So what's next?
Yeah. The next set of skills is what we call interpersonal effectiveness.
Okay.
And those are a set of skills in order to work with, clients sometimes have very difficult times getting along with people, asking for what they want versus indirect or quote-unquote passive-aggressive behaviors. We work on being very direct versus implying. So we work on assertion skills and being able to know what you want in order to ask for what you want and how that helps the relationship.
Okay.
So those are all interpersonal effectiveness skills, and learning how to also say no. So many times people will be quote unquote codependent or they people pleasing and always saying yes, if you will.
Right.
So these skills help in order to say no and feel good about saying no. At least initially you don't feel, not at least, but you don't, one generally doesn't feel good about saying no when they first start if they're always saying yes. So it's a little challenging initially. But clients will build a self-confidence to ask for what they want, be effective, nurture the relationship, and also say no and be effective as well.
Okay.
And that's interpersonal effectiveness.
All right. And then how about after that?
After that, there's a set of skills for emotion regulation. And psychiatrists love this set of skills. I get a lot of referrals from psychiatrists because many clients will feel as though a medication can be the answer.
Right.
And psychiatry will support the work that I do with DBT to collaborate. That medication can perhaps treat the symptom, but it doesn't treat the core issue, like what you were exploring on emotions and where they come from and understanding them. So emotion regulation is a lot about learning about emotions, but also being able to decrease their intensity when they become overwhelming. And one of the key skills in emotion regulation is opposite action, or doing the opposite to emotion. So if one is angry and it's intensified and they want to bring the level of anger down, they would do the opposite of what the anger is asking them to do behaviorally. I don't know if you followed all that, but
well,
it's called opposite action.
Why don't you give an example of that for the audience, if you could, Lisa?
Okay, so, well, if the emotion is anger, for example, the opposite action to anger, which is pretty much all of anger management or stress management skills, is to avoid the situation, because you want to ask yourself, what is the anger asking you to do? And generally, I'll generalize here, it's generally to attack. Or verbally, give someone a hard time. So you do the opposite. You will gently avoid. And then there's another piece to that is if you have to stay there, for example, in an environment, and sometimes family is part of this, God bless them, but nevertheless, sometimes family can be the most challenging.
This is true.
Right?
Yes.
So you have to be decent and not make the situation worse.
Okay.
And then there's another piece to anger and emotion regulation with opposite action in particular is when you're angry with someone, the idea, there's a thought that goes along with anger, and that's generally a judgment that whatever's happening shouldn't be happening in your mind. So you got to take a look at that and see it from the other individual's perspective. And if you can do that and see it from their perspective, even though it doesn't make sense from your perspective, there's a tendency for the anger to decrease if you can see it that way. But that takes a lot of effort.
Yeah, I bet it does, because I'm sure for a lot of these clients, the emotions can be overwhelming and makes it difficult to see things from another person's perspective. And while you were talking about that, I was thinking when you were saying, what is the anger asking you to do? When you said that, I was kind of thinking back to our discussion about creativity, and I was wondering if you've ever had a client kind of view anger as an entity, as sort of like, anger is the enemy, The anger is trying to fool you. The anger is trying to get you to do things that you don't really want to do. So you almost have to treat anger like it's an entity, like it's your foe or your enemy. And have you ever tried that approach with clients, or do you think that something like that might work with them to try to make the anger almost distance? You know what I'm talking about? Like kind of distance themselves from the anger, or kind of make it separate from the client.
Yeah, I like what you're saying. It reminds me a lot of what we call narrative therapy, where we externalize the anger versus we are angry or I am angry.
Right.
More of what is the anger telling me to do? And the goal with DBT would to look at anger in a non-judgmental way. So there's feelings associated, sometimes feeling of losing power, feeling disrespected, or feeling as though somebody's standing in the way of a goal that you want, or feeling a lot of pain. Those sorts of things. We look at it at anger as what's going on with anger, and how is it that it's asking you to attack on this, and how is that effective? So in answer to your question, yes, it's very helpful to do that.
Yeah. So, okay. So now is there one more step? I don't remember what.
Yes, there's one more set of skills.
Okay, go ahead.
And the last set of skills is distress tolerance skills. And those are very effective skills for crisis survival. So these are skills that are very helpful to clients to endure a situation that they can't control. You can't do anything about it. You just have to endure it. You've got to get through it because you can't solve it. These are skills that you can't use a problem-solving skill. If you can, you need to solve the problem. But they're skills to survive and endure a situation. So, for example, what you were saying earlier about clients who self-injure or cut, that would be a crisis. And these set of skills are the skills that really can help a client cope effectively and endure the impulse to cut. So there's a lot of distraction skills, there's a lot of improve the moment skills, there's self-soothing skills that I use with these clients, and they're very helpful. They're also very helpful with addict behavior. So we just study the addict mind, the clean mind, and the clear mind, and that's all new material in DBT that gives clients, those that are diagnosed as addict or alcoholic, alternative ways to cope and be able to identify when the addict mind versus the clean mind are in conflict, and how to deal with that in a harm reduction, as well as abstinence to maintain the clear mind. It sounds perhaps a little convoluted there, and if it does, it would be more clear if you study it, but they're very helpful skills for those in recovery.
Well, we had, on last week's episode, we had talked about co-occurring disorders, and I wonder with the clients that you work with, Lisa, what percentage of them have co-occurring disorders? I'm talking about the clients in the DBT groups.
I would say close to 95% are co-occurring disorders, and there's generally either, it really depends on each client, but once, for example, the depression is stabilized, then you might see the alcoholism, or the alcoholism is stabilized, then you see the anxiety come forth, or the anxiety is stabilized, you might see an eating disorder come forth. So there's quite a few. I don't think I've had a client yet that hasn't had at least a co-occurring, something else is happening there that deserves some time to explore and give some skills to or be treated. The severity might vary, but I would say more often than not, there's a co-occurring disorder happening.
So in these groups, do you address the addiction, or does that not happen, or do you wait until you address some of these other things? I mean, how does that work?
Well, the addiction would have to be stabilized. So I won't have a client in a group, for example, that's active in the addiction. It's just not effective. So they'll be in a group and they would have to be sober and clean. If they could be in, still a rehabilitation process or a center, and they're coming to me for a DBT group in order to enhance their skills to cope with the addiction. But the addiction or the eating disorder or the suicidal thoughts, all, or attempts, all have to be stabilized in order for me to be effective in a group setting. So I can't ask a client who's suicidal, and wants to hurt themselves, for example, did you do your homework? It's just not
Right.
effective. So they have to be stabilized, monitored by a psychiatrist if that's part of the team, and be able to participate in the skills because they're very concrete, but they require a lot of attention and deserve a lot of time to be learned. And you have to have a clarity of mind, at least,
Sure.
at least the willingness. And you can't do that if you're active in an addiction or other kind of disorder.
Yeah, that makes total sense. Well, we often talk about recipes for success on the podcast episodes, and I'm wondering, as you work with these clients, how do you know when a client is successful, or how do you know when a client has improved enough where they don't need to come back to see you anymore? I mean, how do you kind of gauge that?
Well, that time tends to reveal itself. If I understand the question is, how do I step a client down, or actually they transition into life as they would, know it or prefer it? And that comes, I think, with it's very collaborative between myself and the client.
Mm-hmm.
What I will see or what I will notice is that the session starts to reveal itself as more friendly. It's
right.
more like, oh, hi, how are you? Oh, good, how are you?
Uh-huh.
And there's just something happening there where intuitively we both know, I think it's time, and that can happen more often than not. We both see it coming. For example, when perhaps myself and the client, I'll see it coming, but many times I could be off. There's times when I've often thought, this client's doing very well.
Yeah.
And then I'm just about to step them down, or, perhaps they don't need to come in just for a booster session every month, and I'll find out that they're not doing so well.
Okay.
So it's really a matter of the client and I working together, and, if they want to leave treatment for a period of time, and I'm not comfortable with that, or I feel like we're getting close to something and perhaps they're just getting uncomfortable or awkward or whatever it is that might be happening, they prefer not to continue with the treatment, I have to respect that. But I'm also very clear on the boundaries of, I'm not a therapist that will see you when you feel like it.
Sure.
When you come to therapy, it's a consistent relationship and a business relationship that needs consistency until we're both clear that progress has been made. I don't know if I answered your question.
Well,
hopefully I did.
Let me ask it this way. What would be some of the indicators on the part of the client that would tell you, oh, they're getting to the point now where maybe they don't need to see me as often, they're starting to make improvements, and maybe we're sort of we can kind of see termination at the end of the tunnel here. What are some of those indicators that, clients are improving and are getting to that point?
Well, they're coping. The symptoms have decreased.
Okay.
They're building a life worth living and living a life that they're not at home, for example, depressed and unable to get out of bed. They're participating in life. Mm-hmm. The relationships are decreasing in intensity and emotion. Okay. They're not hurting themselves, for example. Mm-hmm. And they're more stable, and there's a sense of they move through that, is that all there is stage, which many times in treatment, you'll stabilize them, and then they're like, is this it? Is this all I get? Can you tell me it's going to get better? Uh-huh. So there's a point where the arc starts to occur that they're living life. And it feels good, and they've got things that they want in their life, and they're maintaining those, and it's good. And maybe there's a time when they want to return, but now's the time perhaps to now you just put it into practice. This is it. You've got the tools, and it reveals itself.
Yeah. So they're adapting. They're using their skills. Yeah. They're not retreating to those old habits where they were either harming themselves or in these volatile relationships or whatever, and they're really doing things that are in their true best interest, I guess. So when you work with these clients, what are the big challenges, Lisa? Because I've heard, borderline patients, you hear about these patients or these clients, and that they're very difficult to work with. And I think a lot of them probably show up in these DBT groups, as you had indicated. What are some of the big challenges in working with this population?
Well, the challenge is, I would say, is to maintain healthy boundaries, and they'll feel safer if you do that, and not getting overly involved or enmeshed with the client, which is just standard of ethical care, but learning as a therapist to maintain very strong boundaries, start and finish at the time that's indicated, and not being overly attentive when it's not necessary, that they need to put into practice their coping skills. To cope with the situation doesn't mean that they don't call for help when they need it, but it's important that they know how to maintain their life and being able to support that, and also deal with somebody not being too happy with you, being mad at you for a period of time. As a therapist, there's many times where a client will be disappointed that I won't call them back right away because they want me to, respond to them right away in their mind. But we talk about that and how to employ a skill to decrease any kind of intensity or reaction. But sometimes it's hard. I'm going to knock on wood right now, but I think I'm more effective with the boundary setting and learning how to maintain that and create client safety. I think that's one of my values, and that's what helps clients feel safe and learn their skills, and they seem very, they seem like they can build mastery. Also, having a team. I can't do it on my own. If I have to have a team in order to help clients, and that means that they need to either have a psychiatrist and nutritionist on board. If I'm just teaching them the skills, they have their own therapist. They have a support system if they're in 12-step program. So having a team of individuals around a client and supporting them is important, and not being alone in doing it myself is very, very key to my effectiveness.
So it sounds like there are times when you work with these clients that you may feel a pull from them to respond in a certain way, or they may be setting traps, maybe not intentionally, but that's just sort of the way that they operate. And so they're wanting you to respond in a certain way. But what I hear you saying is that you have to be firm and you have to set boundaries. And for them, I suppose it's part of the learning process, isn't it? That this is a new learning experience for them to learn how to relate differently to people.
Absolutely. And it's healthy, and they feel safer. Initially, they want to know, am I safe with you? So they might test those boundaries, and then I'm pretty firm, and they know that. And I have a style about me. It's not the same as all the other therapists that might practice DBT. There's a strong style to how I interact, and they seem to be very clear as of the moment. I mean, tomorrow I could be introduced to a whole situation. Oh boy, Christopher, thank goodness I had that conversation with you yesterday, because today's a whole other day.
Yes, exactly.
But yes, I think that's important to the effectiveness, because they build mastery. If they're dependent on me, then they're not going to be able to do this on their own. So I mean, it's not that you don't learn from me, but you put it into practice, and that's building mastery and self-esteem.
Sure, that makes total sense. Well, this last part of the interview is what I refer to as the make a mental note, and it's something that you feel is important for the audience to make a mental note of in terms of improving their mental health, or maybe relationships like we were just talking about here. What's a tip or a suggestion that you might give to an audience member to improve their mental wellness or relationships, Lisa?
I think to embrace and understand, I don't know about embrace, maybe that's not the word I'm looking for, but to hopefully understand that you're not alone, that human beings and living life it can be very difficult. And it doesn't matter who you are, that anyone can find themselves in a situation, no matter how successful, whatever externally everything looks like, etc., that we're human beings, and we're very fragile, and we're very tender, and we just all have that moment where sometimes we need help, and to seek out help and ask for help, and don't be ashamed, that it's nothing to judge yourself for, and it's a human quality that any one of us can find ourselves into, no matter how smart and how successful and etc., that we can all find a time when we might need more help than we would prefer, but just to ask for it.
Yeah, that's a great point, and I think I've heard this stated in some way in the past that making the phone call is probably the biggest step, isn't it? To reaching out for help, that can be so intimidating for people, but it's the
Yeah.
most important thing that they can do to on the path to recovery or just to help themselves out. So I really like those words of wisdom that you gave. Well, if a potential client wants to contact you, if they're interested in setting up an appointment with you, how would they do that, Lisa?
Well, thank you. I would be very honored. The best way to contact me would be direct. I have a cell phone. That's my business cell phone.
All right.
949-212-2081. So it's 949-212-2081. And I'll certainly help anyone out. If not me, I can definitely provide some ideas on resources. Or I have a website, Lisa, Lisa, Bahar, BAHAR.com. It's a website that they want to get if they wanted to get in touch with me. And if you just want to Google who I am and look at some of the articles and media types of work that I participated in on mental health, that's a good way to understand how I approach my work. So that might be a good way to start, is do your research. And I think that's about it. Yeah.
Okay. Well, thanks so much for joining us today. It's really been fascinating to learn about DBT and cinema therapy. These are approaches that I really don't know a lot about myself, and I'm sure that there are a lot of people in the audience who have heard about it but don't know much about it. So we really appreciate you joining us today and informing us of some of this stuff, and look forward to perhaps talking to you in the future.
Me too. Thank you so much for having me on, and goodbye, and to all the viewers out there too, or the listeners.
Okay. Thanks, Lisa.
Okay.
Bye-bye. All right, a very informative interview with Lisa. Great stuff about dialectical behavior therapy. And this actually relates to my mental notes takeaway for today. Clients may experience a lot of different problems, ranging from ruminating thoughts and negative self-talk to emotional meltdowns and even self-injurious behavior. But they can live a better life if they learn some basic tools. And those tools of dialectical behavior therapy include core mindfulness, interpersonal effectiveness, emotional regulation, and distress tolerance. So for people who tend to react impulsively to feelings or just have difficulty managing feelings of distress, these are great tools that they can use to help cope with those feelings and live a happier life. All right, now, this podcast, I always like to make it a learning experience because learning is a key to mental wellness and healing. So, my question for you is this: why do clients cut on themselves? Well, Lisa mentioned that it's a coping skill. For some clients, it offers them a sense of relief or a way to distract themselves from negative thoughts and feelings. For other clients, it's a way for them to feel, or in other words, to not feel numb. So the idea of DBT is for them to examine the function of cutting as well as the pros and cons, and to learn alternative coping skills that are more adaptive. All right, if you like the show notes from today's podcast interview, please visit my website, chrisquarto.com, CHRISQUARTO.com. And as always, please get the word out about this podcast series to friends and family members on Facebook and Twitter. All of these episodes can be found on iTunes and Stitcher Radio. Just type in Make a Mental Note Podcast into Google. It'll take you right to the iTunes website where you can find past podcast interviews. Thanks a lot and have a great rest of the day.